How do you know when your loved one who has a wound requires surgical debridement? I'm Bienstock. I'm a board-certified plastic and reconstructive surgeon. My specialty and interest is wound care for those that are homebound and bedbound. Today we're going to talk about surgical debridement. D-E-B-R-I-D-E-M-E-N-T. What is it, debridement? Debridement means you're cutting out tissue. It's something that surgeons use. Most laymen may not know what that word is, but it's really just cutting out tissue. So a lot of wounds that I do see, because they tend to be either chronic or really nasty wounds where they smell and have all this gunky tissue with a lot of schmutz on it, require surgical debridement. A lot of people, a lot of nurses and a lot of primary care physicians will like to use something called Santal, which is a type of ointment that helps debride that, but that can take a really long time and can delay the wound healing process. So I will commonly perform a surgical debridement. Well, how do I know when a patient is a candidate for surgical debridement? When you see yellowish tissue or black tissue, what we call necrotic tissue, this type of wound needs surgical debridement or surgical cutting. Now, how do I do this? Well, I'm not a butcher from the 18th century. If you see paintings from the 17th or 16th century, you'll see surgeons who are portrayed as like barbaric barbers, like just hacking away at tissue and having these big noses and looking like really mean and satanic. Surgery has come a long way. So obviously I don't have an operating room where I could put your loved one or the patient to sleep. I have to use local anesthesia. Local anesthesia generally is lidocaine or Marcaine. We use this by injecting it locally around the perimeter of the wound as well as in the center after we've washed it out with either betadine, chlorhexidine, alcohol. So I'm very careful with injecting, making sure people have as minimal pain as possible. Most of the time I can get it down to 1% pain, but that's a very subjective analysis. So I really inject a lot of local before I do debridement. Then my goal is to mark out the areas that I'm going to debride, and I usually surgically excise these with what's called a scalpel blade. I'm sure everyone's seen a scalpel blade. Some people use scissors. I like to use sharp instruments. Now, many patients of mine have atrial fibrillation or other chronic conditions which require a long-term blood thinner. That's where, being a surgeon, I have a surgical bovie. This is a big instrument that basically cauterizes the tissue. So I will either cut the tissue out with a scalpel blade, but if they're on a blood thinner, which will make bleeding much more, the patient more prone to bleeding, I'll use my bovie under a burning setting, meaning I'm actually cutting and coagulating, meaning I'm stopping the bleeding and cutting the tissue out at the same time. So what I want to do is, myself or other surgeons who are doing wound care, we want to remove all of the necrotic or dead tissue or slough, which is yellow tissue, so we can get down to pink, beefy red tissue that's bleeding. We want to make sure you get all that bad tissue out. Now, sometimes we'll see bone involved, and they're not uncommon. I'll do a bone biopsy, meaning I'll take a piece of bone and submit this to pathologist to see if there's what's called acute osteomyelitis, or meaning that there's an acute infection of the bone which will require long-term antibiotics. As I said, the most important thing is having as septic condition as possible. Now, in the home, which I do, I'm generally doing an operative debridement in the home. I can't exactly mimic the operating room, but I can do as close as possible. You want to be as safe and do as much as you can. It's not uncommon. I'll do stage procedures, but I'm really able to fine-tune my techniques in giving as much local anesthesia in conjunction with something like Toradol I inject in the muscle to really minimize any inflammation, as well as chronic pain and acute pain. I'm able to sharply excise all this dead tissue, which will help the capacity of the wound. Sometimes the wound smells really bad, and we'll do a surgical debridement, get rid of all that dead tissue. You can imagine, if you remember, like what the garbage smells like if it's been sitting out, or you have an old piece of steak that's lying around. I'm a vegetarian, so I don't know what that smells like right now, but that can smell really nasty and foul. That's what dead tissue can smell like. So you want to remove all that, and it's not uncommon. We have to put your loved one on, who has this kind of foul-smelling tissue, on antibiotics for 1 to 2 weeks. And now, if the bone is affected, we generally have to do 4 to 6 weeks. But without surgical debridement, the wound can really stagnate. So most of my patients, I will do a surgical debridement if it's absolutely necessary. Now, if I see healthy bleeding, like meaty tissue, I won't do a surgical debridement unless it's absolutely needed for other purposes. But most of the patients I get consulted on require some sort of surgical debridement, which means cutting out the tissue. One, to remove all the dead tissue, as well as to stimulate new tissue growth. If you have any questions or concerns, or you have any comments about surgical debridement, please leave them below. Make sure you subscribe to the channel, and make sure you share with your friends. And I look forward to our next episode. Thank you so much. Bye-bye.